So we have the preventive maintenance program, ReCare, is very beneficial. My clients, once I explain to them what it's all about, the benefits for them, whether it be the financial, because we have a 3-tier pricing, it cuts it down to they always locked in at the lowest rate, and so on. I equate it to what they explain to their patients as a treatment plan. They get a brand new patient in with all different issues. I go into an office with all different issues, and we list everything out. But what's nice is the doctor gets to go through and choose what they want to prioritize themselves. Okay, this tubing, yes, I need it I want that fixed right away. Let's hold off on this upholstery until next quarter. They get to pick and choose. They get to see the price. They get to lay out everything. And also, it's benefiting both of us because I know that they're going to have less emergencies on their hand. They know financially that they're able to prioritize and lay everything out in a laid out timeline, and that they're not going to have to say, okay, you have to repair all this at one time, you have to replace all this equipment at one time. No, I can. Gerald says that this is the way it should go, and that's the way that they usually follow. It's nice to have that prioritized, laid out ReCare preventive maintenance program set up.